Is total lockdown the cure for the coronavirus? The city at the center of China's crisis reports no new cases for the second day in a row. Should other cities follow Wuhan's lead and imprison millions of its people for weeks? And is China's experiment the model for us all? This is Inside Story. Hello and welcome to the program. I'm Mohammed Jamjoom. The world was stunned when China's government announced the shutdown of Wuhan, the city at the center of the coronavirus outbreak. The blanket quarantine designed to stop the spread of the disease has never been tried on such an enormous scale in modern times. Wuhan in Hubei Province is home to 11 million people. They've finally been allowed out of their homes after being stuck there for weeks. Their suffering and the government's gamble seems to have paid off. No new domestic cases were reported for the second successive day. So, should the rest of the world take the same measures? Would they work in Italy, for example, now the epicenter of the pandemic in Europe? Despite no new local cases reported, on Friday, many Chinese are worried by the threat of infected foreigners flying in and importing a second wave of the disease. China's government says precautionary measures will be taken to ensure that doesn't happen.
Communities in all regions must establish the system to prevent and control the import of overseas epidemic and implement the grid management to register, trace and manage the entry passengers with classification. We must conduct full coverage management for the entry passengers and their families.
We'll speak to our guests in a moment, but first let's take a closer look at how China's government has dealt with the outbreak. When the alarm was first raised in December by a doctor, he was arrested and reprimanded. Dr. Lee Wen Liang later died of the disease and has since become a hero to many Chinese. Eventually, China alerted the World Health Organization about an illness similar to SARS, another health crisis which started in China 18 years ago. By late January, more than 600 Chinese people were infected with coronavirus. A lockdown was imposed on Wuhan and its 11 million citizens. A global emergency was declared at the end of January. By then, 213 people had died in China and almost 10,000 had been infected. The total now is above 81,000. All right, let's bring in our guests in Hong Kong. Professor Nicholas Thomas, who specializes in Asian health security issues at the City University of Hong Kong. In Nottingham, in England, is Steve Tsang. He's director of the China Institute at the School of Oriental and African Studies, University of London. And in Reading, also in the UK, Al Edwards is a professor and immunologist at the University of Reading. Welcome to you all. Nicholas, let me start with you. When China announced it was shutting down Wuhan to prevent further spread of the virus, many were stunned. There was a lot of skepticism. Quarantine on this vast of a scale had never been tried in modern times. Many wondered if it would work. So has China and its approach now been vindicated?
I think China and its approach has been vindicated insofar as it applies to China. I think other countries out there are trialing their own ways of dealing with this and doing it quite successfully. But I think what China showed us is that it overturned what had been a bit of a debate going on within the field as to whether or not quarantines should be used in the first place. And certainly, as you said, on this scale, it was something that hadn't been done before. But I think what the example from China has shown us is that with the correct amount of resources and both the social support combined with the political will, such efforts are possible.
Al, South Korea's approach to COVID-19 has been praised, but it was very different. Singapore and Taiwan were also praised in how they handled combating the virus for their contact tracing efforts. Are Wuhan-style measures necessary to contain the disease?
I think that there are a number of different examples there. Its situation in South Korea, for example, is very interesting because they seem to have been able to be very successful using a testing and tracing based method. But I think it's important to remember that this might be in part due to the sort of pressure they felt a few years ago when they had a big outbreak of the MERS coronavirus. So in some ways, they may be way ahead of the curve, and that may explain their success in their containment strategy.
Steve, from your perspective, do you believe that quarantines of this type will become the new normal?
Well, we are seeing that being much more widely adopted in many different countries, including some of the established democracies in Europe and in North America. But to go back to your earlier questions, I think we should bear in mind that Taiwan, which has not been mentioned, has also adopted a test and trace system, and that works very effectively. We should also bear in mind that when China imposed the lockdown on Wuhan and then Hubei Province, it was meant not only to reduce the cases in China, but it was also meant to reduce the spread of the virus beyond the original epicenter of it. And we are now seeing that the virus is practically all over the world. So in the wider objective, the lockdown did not actually work.
Nicholas, I saw you nodding there. Did you want to add to that point?
I think that the case of Taiwan is a very good one. And I think the critical point there is it doesn't matter what the political regime type is, if it's a democracy or if it's authoritarian or somewhere in between. Different states with different scales and capacities can now have a range of measures they can adopt. All of them, however, when you look at Singapore, Taiwan, and also South Korea, have a high technology basis and a willingness to use that technology in defense of the society when you do have a coronavirus outbreak. I'm not sure I agree with Steve's point that the quarantine failed. I think rather the failure was on the part of the European and North American countries who looked at China and perhaps were a bit too complacent in the way they approached the virus.
Al, right now China is claiming success, but initially there were many flaws in China's coronavirus strategy, right? And those mistakes really contributed to a surge of transmission, right?
So I think the one thing we shouldn't forget is that what happens when something new arises is that it is just that, it's new. And I think in spite of everyone's preparations all around the world, and in spite of the fact that this kind of outbreak is not unexpected and it's not unknown to science, the precise rate of transmission of this particular virus seems to have been what's caught everybody unprepared. So I think if we look back at mistakes that have been made, what's really clear is that it's the very rapid rate of transfer through populations which is causing so much problems.
Steve, so the threat of coronavirus is diminishing in China, but at the same time, the government has continued to push hard to control what is said about itself. So you've had news being actively censored, citizen journalists have been detained, foreign journalists have been expelled. What else is going on there when it comes to this?
Well, if you look at the composition of the most senior organizations responsible for the virus, the leading small group for countering the virus, which was set up in January, you can see that the one area that the Chinese government wants most people on was not on public health or on the economy, but on propaganda. And that shows you that from the very, very beginning, the Chinese government put higher priority on controlling the narrative of how the Chinese government is dealing with the virus than actually dealing with the virus. And so we can see that once the Chinese governments have found themselves in a situation that they would be able to project themselves in a more positive light than how the rest of the world seem to be dealing with it, particularly the democracies. They have seized that moment and have controlled that narrative and have done so very effectively. And that's basically where we are. And therefore, we are all being directed to focus on how well the Chinese government has been dealing with it. I think we should all be pleased that the virus is more under control in China. We want to see that being under control everywhere in the world. But making that narrative and contrasting it is more for political purposes than for countering the virus.
Nicholas, China the last 2 days is reporting no new local infections. Is the threat now the threat of imported coronavirus infections?
Absolutely. Beijing, as of yesterday, had reported 65 new imported cases. And this is now the worry that China has, in that all the people are now coming, all the Chinese citizens are now coming back, particularly from Europe, transiting other airports around the region to get back into China and get away from the threat that they're now seeing in Europe, and bringing with them a lot more imported cases. But it's not just, obviously, China. Singapore had something like 40 new cases, of which 30 had been imported. Here in Hong Kong, we've seen a spike of roughly 16 new cases, of which I think 14 had travel history to them. So this is the next wave as far as China's concerned. But at least in terms of detection and tracing, because they're scaling down in terms of ongoing community-based transmission across China, they can redirect those resources, and usually fewer resources, towards tracking, tracing, and quarantining people who are bringing in the disease from other countries.
Al, what's the situation currently in Wuhan? Is it still largely under lockdown, or are some of the restrictions starting to be lifted?
So I'm not so familiar with the exact situation on the ground, but I think, to echo some of these previous comments, one of the things that everyone in the world needs to be really focusing on is trying to make sure that they absolutely maximize the resources that are available for things like testing and responding to these outbreaks, because I think that's going to become more and more clear that there's got to be the very best use of the resources that we do have, having established that it's very, very rapidly transmitted, and also secondarily that if there's a sufficient resource deployed correctly, that the number of cases can be kept under control. It's really vital that everybody puts those two things together and makes very best use of the resources they have.
Steve, human rights activists have been making the argument that the fact that China was able to lock down millions of people so swiftly with practically no advance notice, that should not be considered anything other than terrifying. What do you say to that?
Well, I think there is a lot to be said about that, and that is why I underline the case of Taiwan, where they have used a lot of the tests and track methods, but doing so respecting rights of individuals. And it has worked effectively in Taiwan, a country of something like 22, 23 million people. So it's not a small place like Hong Kong or Singapore. That shows you that even for people of Chinese heritage and Chinese cultural background, different ways of dealing with it can work very effectively, and you don't have to go to the very extreme way how Wuhan and Hubei Province were being dealt with in order to contain the virus. I think the really important thing at the moment is that we need to think beyond national boundaries. It is a global pandemic. Until the last country with the virus has managed to contain it, we have not contained it. And therefore, looking at one province, one city having contained it or not really is not a very constructive way to confronting this challenge that we all, as members of the humanity, are facing collectively at this point in our history.
Al, it looked to me like you maybe wanted to jump in. You were nodding along.
I couldn't agree more. I think what we're seeing locally here in the United Kingdom is lots of things happening very, very quickly. But one thing that is really astounding me is the level of change that people are dealing with. So as mentioned, regardless of the political, cultural background, extraordinary changes are needed in individuals' behavior. I'm not qualified to comment on how that change is achieved. But what I would like to say as a slightly positive note is that in spite of this huge threat and the fact that it is, as mentioned, it's an uncontrolled global pandemic at this stage. Certainly what I see locally, and I think this is echoed from news stories we've heard around the world, is that people are rapidly responding to try and ramp up the capability. So when the resources for testing, for example, weren't as widely available, we are jumping and scrambling to increase that resource and make testing more possible on a larger scale. So I expect to see a lot more of this in the coming weeks and months. If you're living somewhere which has not been directly affected yet, and you believe that it's something that happens in another country, that's wrong. This is happening everywhere now, and the sooner that people can respond and get measures in place and understand what's going on, the better chance we have of slowing this thing down.
Nicholas, advocacy groups have said that China's draconian measures did indeed slow down the virus, but it also came at a very high cost. So let me ask you your opinion on this. Have human rights become a victim in the battle against coronavirus?
I think that China was faced with a double worst case scenario. I think the Chinese CDC realized that the policy measures being implemented on the ground in Wuhan were going to be insufficient. And at the same time, Chinese New Year was looming, which is the single biggest annual movement of people. Those two factors combined with the increased global connections of Chinese cities to the rest of the world really left the Chinese officials with very little choice. Now, the quarantine measures worked. At the end of the day, they worked. Now, yes, you're talking about an authoritarian country where liberal ideas of democracy are not necessarily going to be present. But at the same time, the overwhelming focus after around the 21st, 22nd of January was in stopping this virus in its tracks, not just for the benefit of the Chinese people, but also to ensure that there was a degree of confidence in the Chinese system internationally. And this is, it has to be said, this is where we're sort of getting to now. The issue that we have going forward is to what extent that model is translatable into other political systems. And there I'm not sure it is, which is why, as I think all three of us have been saying tonight, that the Singapore, Taiwan, South Korean models, with their more advanced use of technology, contact tracing, and so on, perhaps represent a more translatable model and set of protocols for different countries going forward.
Steve, I want to talk for a minute about Dr. Lee Wen Liang because his death sparked such a massive outpouring of grief in China, and it certainly worried the government because that was happening. So just in the past couple of days, China announced that it has now posthumously exonerated Dr. Lee. They have issued a formal apology to his family. They've also apparently doled out disciplinary punishments to 2 police officers for their handling of the matter. How significant is that?
Well, it certainly is a step in the right direction. It would certainly be welcomed generally, but then the reality remains that the 2 police officers who are now being disciplined were doing exactly what their orders were. And what happened to Dr. Lee did not just happen to Dr. Lee, it happens to many others. And the issue there really isn't so much what happens to an individual doctor. The crux of the matter here really was that the party state systematically cover up. We're talking about at least 6 weeks and probably for 2 months when they knew about human-to-human transmissions and they were being warned about it, and they, instead of doing something about it, cover up and allow that virus to get transmitted, and still are not sharing all the information that will enable all involved anywhere in the world to be able to understand better how the virus originated, and therefore put us in a stronger position to contain the virus and perhaps to prevent something similar from happening again, even if we can contain this wave of the virus. So yes, it's a good thing that they have apologized to Dr. Lee, for something that should never have happened in the first instance. But that does not represent a change in policy. It represents a change in public relations management.
Nicholas, let me ask you about Chinese President Xi Jinping. Is he going to be able to leverage this crisis to strengthen his grip on power?
Well, I think actually that question gets back to your previous question about Dr. Lee. I think it shows, I think the state officials' reaction with the posthumous admonition being revoked, I think it shows that the Chinese state itself has become far more greatly sensitized to this issue and to the role of public opinion than they have been for previous outbreaks. And in that sense, I think what we're seeing is an attempt by the Chinese leadership to shore up public support, to acknowledge a significant enough breakdown of trust between the state and society, but at the same time, not a critical one. But instead, they're saying, okay, yes, we made mistakes. I mean, they're actually admitting to this as a way of mitigating the public opinion, the negative public opinion which is circulating on social media, at least before it gets censored. And they're starting to try to implement this next stage, which sets up China for having successfully overcome the virus, as Steve was mentioning earlier on, and then beginning to shape that narrative into China succeeded here, and we can now be, if you like, a health power role model for other countries going forward.
Al, within China, many provinces shut themselves off to travelers from elsewhere. How much concern is there that the virus will re-emerge once these barriers are lifted and people begin traveling across the country again?
This is the bit that's, the grand challenge for the next, foreseeable future. And I really think nobody has any clear idea how long this is going to take to deal with. Whether it's China or any other country, if you can get, and it's exactly the same for some of these other countries which have responded in different ways but succeeded in controlling things, that you can suppress the fire, but there's still fuel there. So whilst there are people who have not been infected, and whilst there's no vaccine, what's really striking sort of from a biological, virological perspective is quite how quickly this virus spreads, combined with its, really serious mortality rate and sort of toxicity. What that means is that maybe we're going to get stuck in a position where people can either move around or they can be safe, but they can't move around and be safe. So I think that really brings on the next, challenge, which is to make sure that we learn from the systems that are working in terms of tracking and tracing and testing, how quickly and on what scale can we do that kind of tracking and tracing so that we can start to plan for a future where we can reconnect and we can build up global travel and local travel, but suppressing this infection. That's going to be really difficult. And we haven't mentioned really yet, but there are many countries in the world which are really going to struggle even more with that, because either the way that their society is set up makes it very hard to do these things, or technologically they may not have the technology and the money and the resources to actually do this kind of testing.
All right, well, we're going to have to leave it there because we've run out of time. Thanks so much to all our guests, Nicholas Thomas, Steve Tsang, and Al Edwards. And thank you, too, for watching. You can see the program again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Mohammed Jamjoom, and the whole team here, bye for now.